Learning and Teaching B.Ed syllabus, second semester. The question is, write the causes of mental retardation. What is mental retardation? It is defined as an intellectual functioning level, that is, as measured by standard test for intelligence quotient, well below average, and significant limitations in daily living skills, that is, adaptive functioning. There are four main categories of mental retardation. First, mild mental retardation. Approximately 85% of the mentally retarded population is in the mildly retarded category. Their IQ score ranges from 50 to 75 and they can often acquire academic skills up to the 6th grade level. They can become fairly self-sufficient and in some cases live independently with community and social support. Second is moderate mental retardation. About 10% of the mentally retarded population is considered moderately retarded. Moderately retarded individuals have IQ scores ranging from 35 to 55. They can carry out work and self-care tasks with moderate supervision. They typically acquire communication skills in childhood and are able to live and function successfully within the community in a supervised environment such as a group home. Third is severe mental retardation. About 3 to 4% of the mentally retarded population is severely retarded. Severely retarded individuals have IQ scores of 20 to 40. They may master very basic self-care skills and some communication skills. Many severely retarded individuals are able to live in a group home. And fourth is profound mental retardation. Only 1 to 2% of the mentally retarded population is classified as profoundly retarded. Profoundly retarded individuals have IQ scores under 20 to 25. They may be able to develop basic self-care and communication skills with appropriate support and training. Their retardation is often caused by an accompanying neurological disorder. The profoundly retarded need a high level of structure and supervision. Let's see the causes of mental retardation. Under this, we have three stages. First is prenatal causes, that is, causes before birth. Chromosomal disorders, Down syndrome, Fragile X syndrome, Prader-Willi syndrome, Klinefelter syndrome. Single gene disorders, inborn errors of metabolism like galactosemia, phenylketonuria, hypothyroidism, mucopolysaccharidosis, Tay-Sachs disease. Neurocutaneous syndromes, tuberous sclerosis, neurofibromatosis, dysmorphic syndromes, Lawrence-Moon-Wedel syndrome, brain malformations, microcephaly, hydrocephalus, myelomeningocele cell. Second is abnormal maternal environmental influences, deficiencies, iodine deficiency and folic acid deficiency, severe malnutrition. Substance use can be alcohol, nicotine, cocaine. Exposure to harmful chemicals, pollutants, heavy metals, harmful drugs like thalidomide, phenytoin, warfarin, sodium, etc. Maternal infections, rubella, toxoplasmosis, cytomegalovirus infection, syphilis and HIV. Exposure to radiation and RH incompatibility. Complications of pregnancy, pregnancy-induced hypertension, antepartum hemorrhage, placental dysfunction. Maternal disease, diabetes, heart and kidney disease. And the third is during delivery, difficult and or complicated delivery, severe prematurity, very low birth weight, birth asphyxia, birth trauma. Under that neonatal period, septicemia, jaundice, hypoglycemia, neonatal convulsions. Secondly, infancy and childhood, brain infections like tuberculosis, Japanese encephalitis, bacterial meningitis, head trauma, chronic lead exposure, severe and prolonged malnutrition, gross understimulation.